Diabetic retinopathy. Introduction. Please point to the retina. Choose one of the following options. Correct. This is the retina. Proliferative diabetic retinopathy is when blood vessels of the retina sprout, bleed, or rupture. Select true or false. Correct. Proliferative diabetic retinopathy is when new blood vessels sprout abnormally, bleed, or rupture. Can only people with diabetes develop retinopathy? Select yes or no. Correct. Anybody can develop retinopathy, but people with diabetes are at a higher risk because diabetes damages the body's blood vessels. Is it true that early stages of diabetic retinopathy have clear symptoms such as loss of vision? Select yes or no. Correct. Early stages of diabetic retinopathy may not cause clear symptoms. Once symptoms such as blurred vision, missing areas of vision, floaters, or severe vision loss develop, the retinopathy is most likely severe. Is it true that eye doctors can see changes in the eye only after diabetic retinopathy advances to the proliferative stage? Select yes or no. Correct. During the non-proliferative stage, eye doctors may see small hemorrhages within the retina, dilated blood vessels called microaneurysms, areas of poor circulation called cotton wool spots, fatty deposits indicating poor circulation and leakage, which are called exudates. Thank you for using Explain.